Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at JointRehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here in the studio, 866-870-5752. Call now and speak to Dr. Darrow. And you can't often get him for free, so here's your opportunity. I'm telling you, 866-870-5752, and you get his latest book for free when you call. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And the website... So let's go back to... Go ahead. Okay, go ahead. Do that. Go ahead. Okay, I'll do it. You want to flip a coin? Yeah, let's do that. www.lastemcells.com. www.lastemcells.com. Please watch the videos. And you can learn all about regenerative medicine and how I inject and get the platelets from your blood and how I get your stem cells. In tough cases, we use stem cells and platelets mixed up. So I don't want to have Leslie wait too long, so I'm going to get to her, okay. Nina. So Leslie, Dr. Marc Darrow, your shoulder's bothering you. How long did it bother you for?
Well, I have a multitude of things that have been operated on and that I'm, being currently treated for. So it probably appeals to a broad range of your audience. But first I want to say, Doctor, that
Wonderful.
I've never called in to anything. I found this station by accident while I was
That's
out.
great.
Well, we're going to take good care of you, Leslie. We're going to love you so much you're going to call everybody from now on.
Well, I want to just give you a slight background. I'm 75. I look about 50 because I'm very active. I have horses. I have an animal rescue group in Santa Barbara that I tend to daily, and we rescue everything from guinea pigs to horses and rehome them. So I am very active, and because of the health problems I've had, it's really made it very difficult to care for as many of the animals as we would like, because we have all volunteers. We don't take any salaries whatsoever. But anyway, I've had
let me do this. Let's go to the crux of your issue. What is that?
Okay. My main problem right now that I'm concerned about is my right shoulder, and I've had 2 open shoulder surgeries. And you're right, they take a year to 2 years to try to get, back to some normalcy. I still have to have every 3 months an injection into my right shoulder. Okay. I'm sure it's just
that's with cortisone,
right? And I've also had 2 full joint knee replacements, and I've had spinal surgery about 20 years ago because I have severe spinal stenosis. The thing I'm worried about is I had to have nerve root blocks and some other epidural treatments to my back, which they're hoping will last about 6 months. But it affects every part of my body. So the only way to keep my right arm going is with these injections. Now, my doctors talked to me about the PRP, and I go to the Spinal Institute in Santa Barbara. And so I'm very interested to read your book and to hear more about, what you can do, because it really takes you totally out of commission, especially for somebody like me that basically has such an active lifestyle normally. And
let me knock out these things one at a time, if you don't mind me talking for a while.
No, that's fine, and I'm sorry for going on. I just wanted to be sure you had a full picture.
No, it's good. It's good. You have a long story. You've had a lot of things going on. So number one, this is just my opinion. I'm just one guy. I have my experience. I'm not against surgeons or surgery when it's needed. I'm never against surgeons. I mean, they're needed no matter what.
but not for these musculoskeletal operations anymore, because unless you have something that's terrible, there's absolutely no reason to have a surgery in the musculoskeletal system. So you've had 2 open shoulder surgeries already, and now you're getting steroid shots every 3 months. So what that does is it destroys the tissue you have left. Whatever cartilage you have left in there is being dissolved away. So it's like you win the battle for 3 months, and then you lose the war. You want to win the war, not lose it.
Exactly.
So yes, you're a candidate.
I can't have any more surgery to the right shoulder, so that's why we opted for this, because the prognosis was bad. So they're just trying to keep me going now.
Okay. Well, I don't want to keep you going. I want to get you fixed. And the way to fix all that.
That's what I would like.
Yeah, and I have one point of view for you. Don't ever go to a surgeon to get PRP or stem cells. Okay? I want everybody to hear this. Because can I talk a little bit, Leslie?
Yeah.
I want to get these ideas out to everybody. No, it's okay. Okay, you can just wait for a minute. Let me just get this out to everybody. Everybody that I know of that's come to me that had a injection of PRP or stem cells from a surgeon has always said, and this is probably not the case 100% of the time, they said the surgeon said it didn't work and now they have to do surgery. Well, that's because a surgeon's main goal is not to do regenerative medicine, it's to do surgery. That's their religion. My religion is to rejuvenate the body, not to cut things out. I was in training to be a surgeon, and after my surgery on my shoulder that completely screwed it, excuse my French, I got out of doing surgery and I went into regenerative medicine when I learned about it. I love my surgeon. He was my professor and my boss. I love the guy. He was wonderful. It has nothing to do with him. So my comments are not about the surgeons. They have hard work they do. I praise them. If I were wearing a hat, which I am right now, I'd take it off. And I'd take it off to the surgeons. But I'd have to say these surgeries, for the most part, shouldn't be done. We have enough research on it now to know they should not be done. There are cases they have to be done, but most of them should not be done. At the same time, don't go to a surgeon to get regenerative medicine of PRP and stem cells. They don't believe in it. They do it as a way of keeping the patient happy and bringing patients in, but these patients are often told afterwards it didn't work and now you need to get surgery. Well, one of the issues is these things are not magic that I do. Sometimes they have to be repeated several times to grow enough tissue to heal the area. It's not a one-shot deal. It can be. I've had my first injection I had was in my wrist, and I was 50% better the next day. But then I had to inject it about 5 more times to get it pain-free. My shoulder, after a failed surgery, and I learned about this, I injected it, was 100% healed the next morning. I don't know how that happened. I really don't. It was like magic. But I've had other areas on my body I've had to inject several times. And typically the surgeons are not going to inject enough to heal the area. They're going to do it one time and go, look, it didn't work. Now you need surgery. So I would never go to a surgeon to get regenerative medicine, just like I wouldn't go to a regenerative medicine doctor like me to get surgery. So I hope that makes sense. The other maxim in medicine is always go to the doctor that does the most of what it is you need. Don't go to somebody who does it once in a while. Go to the guy that does it all day long, okay? Be careful which doctor you choose. Go to the expert. Go to the guy who's been doing it the longest. So if I wouldn't be getting those steroid shots. Number one, that cortisone should not be done every 3 months. You've already had 2 knee replacements. I'm going to bet you anything, and we can't turn back the clock. I'm going to bet you didn't need those knee replacements, And I get people every single day who come in who have been told by multiple surgeons they need knee replacements, and they never needed to do it anyway. We get them fixed just by injections of platelets and stem cells. Now, the spinal stenosis surgery you had, I'm going to guess, and I don't know, I wasn't there, didn't need to be done. Because most people that I get in the office with spinal stenosis, ready for a back surgery or neck surgery, don't need it. They have neck pain or back pain, and they get spinal stenosis surgery for that. Shouldn't be done. If you have a dead limb and the nerve is being squeezed so hard that there's no juice getting down there, no electricity to the muscles, yeah, you need a spinal stenosis surgery. But most people that I get that come in to see me don't have the leg or the arm symptoms. They have neck pain or back pain, and they're about to get a surgery for that when they don't need it. I had a gentleman come in yesterday. Same situation. It was a workers' comp case, and he said that they told him he needed surgery. I touched his neck, and I found the spot, and he didn't have anything going down his arms. And I said, well, you don't need surgery. And he said, but look at my MRI. It's got all these problems. And I go, we don't treat the MRI. We treat you. Don't let a surgeon treat your MRI. Most people that get these surgeries have never had a physical examination by the doctor. The doctor slaps an MRI up on the wall on the light box and goes, you need surgery. Look at that. Patient doesn't know. So they get seduced into a surgery that often doesn't work. I fight with my patients. Don't get the surgery. You don't need it. And a lot of times they come back after the surgery because they don't listen to me. And then they say, can you help me? I go, I can't help you anymore. You've got metal in there. You've got a joint replacement, whatever it is. It's not biologic anymore. I can't help that. Done. You can't, go ahead and close the barn door after the horses are gone. It doesn't do you any good.
I can relate to that.
I'm sorry you had all these surgeries. You probably didn't need them. For someone to have had, you've had 2 on the shoulder, 2 knees, so that's at least 4. And then you had the 5th one on the spinal stenosis, and you probably didn't need that.
About 20 years ago, but that actually was life-changing at that point because I was
Well, look, I'm not putting down every surgery. There are times when you have to do it.
Right.
But don't do it for neck or back pain.
But now they're worried that I need spinal fusions, which I really do not want to do. And so they have a whole pain management division, and I'm seeing Dr.
Well, my point of view, you stay away from those guys because they're going to load you up with drugs.
Well,
and drugs are not the answer.
They're trying to do the epidurals and nerve root blocks to save me or prolong me going in for the spinal fusions, but I really don't want to do that. I'm managing the pain. I, am very slim and healthy, and other than that,
good.
And I simply do not want to have any more surgery. So that's why hearing a few words from you was so encouraging, because I thought, is there anything I can do to avoid, the spinal fusions? And I'm doing really well. And I have
in order to answer that question, I have to examine you. I have to touch the area and see where the pain is being generated from. You might be the person that needs surgery. I don't have the answer until I touch the body and see what's going on.
Right. Okay.
Make sense?
It makes a lot of sense. And all I know is I really don't want to have surgery. I just want to keep managing the pain and having my life and saving the animals.
Yeah, I'm with you. Why would somebody want surgery? I get so many people that come in the office who want surgery. I don't understand it. The risks are high, even on a tiny little surgery.
Well,
things can go wrong.
I had my age. I just don't want it.
Well, you're not that. You're pretty young.
75 is not young. I'm very deceiving when you see me. It's I look absolutely 20 years younger.
I want you to deceive me.
Send us a picture.
Email me a picture.
will. I've got your email.
You know, it sounds, Leslie, like you ought to come into the office. Let me check you out. And the phone number to the office, if you want to come in, is 800-300-9300. But start with the website, www.lastemcells.com, lastemcells.com.
Right.
Look at the videos of how I do this stuff. See if you want to do it. See if you think it'll work.
From what I understand, the PRP is not covered by Medicare, I think, at this point. They said it's almost it almost is, but there's still another.
It almost is.
Yeah, well,
you'll have to call the office about that.
They're checking it out, right? So, but that sounds incredible. I didn't know that I had any other options, but I do know that they have a whole pain management division, and if you want to look them up, it's the Spine Institute of Santa Barbara. But Dr. Mulligan did my spine surgery 20-some years ago and literally changed my life because I couldn't move. It was so bad. So
well, God bless him and God bless you. We're going to move on, Leslie.
Thank you so much, Leslie.
Thank you so much.
Call.
It's wonderful talking to you, and we all love you, Leslie. Thank you.
And don't forget to send those photos. Our number is 866-870-5752 here in the studio. You can call and talk to Dr. Darrow right now. I have lines open for you. That's 866-870-5752, and you get that free book. It's a win-win. Do you have another question waiting?
Are you kidding me? I have thousands of questions. Here's one on a herniated disc. Let me talk about that because we get so many people here with herniated discs that come in to see me. Neck, usually it's the neck or the low back. Not very many thoracic herniated discs, but I do see them occasionally. So what did this person say? Oh, I just had back surgery for the 4th time in my life, and I'm facing having a back fusion if my discs herniate again. I'm interested to know if PRP will help in my post-operative recovery and be good to prevent future injury. So this is a case very much like Leslie, who we just talked to. Thanks for that call, Leslie. I need to touch the area and see if I can find where the pain generator is. I've had people before who have 3 or 4 surgeries, and I touch the back or the neck, and I find that they never needed that surgery to begin with because I can find the pain generator with my hands, and it's nowhere near the area that was operated on. Go figure. Why was the surgery done? Because a lot of doctors are trained to do surgery. If you are trained to do surgery, that's what you're looking for. You're going to look at the MRI and look for herniated disc or facet arthropathy or degenerated disc disease or something like that that certainly doesn't need surgery because it's not going to help. And then they go back and get another one. And then I can fix them often because the area was not a surgical area. The pain was not generated there. I cannot tell you over the last 20 plus years how many times I see this. I see it almost every day of the week. Don't jump into a surgery when you do not need it. The risks can be very, very high. The risks with regenerative medicine using platelets and stem cells is very, very low. It's just an injection. You walk in, you get an injection, and you walk out. I like it.
Sounds good to me. Our number is 866-870-5752, 870-5752. Go to Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. Email him off of every page on the site and watch him performing the treatments on video. Very exciting stuff, actually. And
do you want to hear about hormones and skin?
Yeah,
or you got
no,
more to
go
say?
ahead. Hormones and skin, I'm in.
How come people say, yeah, no? Have you noticed that? You just did it. You're busted.
That's okay. It made you laugh. That's what counts.
I love laughing.
I know you do.
I laugh all day long. So this person has a question. It says hormones/skin. So I jumped and opened that one up. That's interesting. Let's figure it out. So this person says, I'm feeling pretty good at age 82. Why not? 82 is young these days. With skin issues as my biggest problem. I will not chase my tail to look like what I'm not, but want to look and feel as good as I can. That's smart.
Yes.
Stem cells is the thing I'm most interested in. Have listened to you on your show for a long time. Well, thank you so much. My daughter also came to you for her knee and had amazing success. I would love your book on hormones. Interested in that. Okay, we're going to flip you back a book, an ebook on hormones. If you come in the office, I'll give you a hard copy, and we'll give you a copy of my book on musculoskeletal medicine, on platelets and stem cells to get rid of musculoskeletal pain. But yeah, we can make your skin look a lot better. And we would do what's called the vampire facelift if it's your face. If you need to grow hair on the top of your head, we can still use platelets and stem cells. These things are magic little cells, and they can do a lot. So they can grow back the collagen in your face that dries out as we age. I do get tons of people in their 80s and 90s who look amazing. Amazing. I don't know what's going on. There's something going on. My mom died about 5 years ago. She lived to 102.
Wow.
Full of a lot of energy. Brain was good. What is going on? I don't know. But people are living a long time. If you notice, the kids are getting very tall. My 17-year-old grandson is 6'5", and he is still growing, it seems. So it's a new race of humans coming forth. They're living long and they're getting bigger, and I love it. Most of my nieces and nephews the males are around 6'4", the females are around 6'2", 6'3". I don't get it, but it's happening. So there's no reason to think that 82 is old anymore. And we get a lot of people in their 90s, a few people who are 100 who come in and are doing very, very well. We can do hormone replacement therapy. By the age of around 30, people are losing their hormones. And when that happens, the muscles dwindle, the sex drive goes down, and the brain starts to deteriorate. And menopause is an issue. Andropause
okay, I'm going to interrupt you for a sec.
And yes, I know, because someone wants to talk about the vampire facelift. I heard you breathing.
Before we run out of time, Alice in Pasadena.
Alice, Dr. Marc Darrow, tell me about the vampire facelift. What do you want to know about it?
What I'd like to know is, how many treatments do you normally have to have for sagging jaws? And how often do you get them?
Okay. Everything in this world is different for every person. Mm-hmm. And same questions I get about someone with arthritis in their body. How many sessions will it need? You have to talk to Michelle Darrow, who does the vampire facelift, and get specific. So to come in, call the office, 800-300-9300, and you can meet here, and we'll get you more information on that. God bless you.
Awesome. Thank you, Dr. Darrow. Thank you, Alex and Suzette, and everyone who called and participated and listened. Grab a pen or a pencil, write down this important information coming your way. Remember to listen to The Pet Show with our friend Warren Eckstein, 11 to 1 every Saturday, and we'll see you next time.
Thank you, Nita.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.